Welcome to Adapt NCLEX. Health promotion is very important on the NCLEX. It can break you. Maternity is a portion of it. And today we're going to talk about reproductive aspect of maternity. Stick around, get the pen and paper, 12 questions, challenge yourself, see how much you get. I know you can get it. Let's get to it. By the end of this video, you understand some of the key aspect concepts you're supposed to know for reproductive aspect of it. I'm going to guide you. This question may be challenging, but I know you will get it. Which infection should the nurse anticipate? Read the question from the back. It's a selected apply. Don't over-select. Then look for the buzzword. A nurse in emergency department is assessing the client to report what? Is urea, yellow, green, vaginal discharge, and pelvic discomfort. There's a reason why these symptoms are there. The provider suspects sexually transmitted infection and informs the nurse that the case must be reported to public health authorities. Which infection should the nurse anticipate? Selected apply. Chlamydia, gonorrhea, trichomoniasis, candidiasis, genital herpes. Pick your answer, pause the video, and then listen to the way I'm going to approach it. After you pick your answer, this is the way you should proceed. Select or apply. Tell yourself, I'm not going to pick everything. What are they asking me? Infections, underlying infections. About what? The nurse is in the emergency department assessing me because of what? Dysuria, yellow vaginal discharge, and discomfort. Infection. This is STI, sexually transmitted. Okay, the provider said these has to be reported. What do you think is the most important? Reporting. That is the key. All of them. Infectious disease. Nobody cares. But the most important, it has to be reported. And that is what the nurse is being asked. The nurse is not being asked what is infectious disease associated with it. What is the problem? Chlamydia. You got to report it. Gonorrhea. You got to report it. Trach. You don't need to. Candidiasis, it's not even infectious disease. And then genital herpes. Even though it is, it does not need to be reported. Only two answers. Pay attention to the question and the buzzword, and I know you pick it. These are the one that has to be reported. If you pick anything, you lose a point. Don't run away from this because I know you got it. A nurse is obtaining obstetric history of a pregnant client. Some of these questions can be long, especially when they come to GT power. Be careful, slow down, underline every keyword, and then translate every statement into a word. The client reports the following. Deliver one child at what? 39 weeks. Had a miscarriage at 18 weeks. Delivered twins at 29 weeks. Who died 2 days after birth. Currently pregnant. Which of the following is the correct documentation of this client obstetric history using GTPA? Pause, analyze each word, figure out what it is. There's a way you can eliminate the answer. You pick your answer, pause the video, and put down your answer in the comment section. But this is the way we should approach it. First, you know, G, I'm in a pregnancy. Start from the top. One child at 39 weeks. I have one. I had miscarriage. It's still pregnancy. G is the number of pregnancy. 2. I had twins. You don't count number of twins. Just one big pregnancy produce the number of twins. It does not matter if it's 5 twins, 6 twins, but one pregnancy. Therefore, and currently I'm pregnant. Therefore, this is G4. This is eliminated. Now, what is our term baby? Who went to term? There was only 39 weeks. Only one baby went to term. None of these went to term. Therefore, this is still in the game. Then P, preterm. How many were preterm? Preterm less than what? 37 weeks. I have one miscarriage, right? And then I have 2 babies born 29 weeks, but they were all one pregnancy. Which one would you pick? Do you pick P2 or 1? You don't pick P2 because 18 weeks is less than 20 weeks, and therefore that becomes abortion. So BA1, you split it A1 and what? P1. P1 less than what? 37 weeks, but greater than 20 weeks. This one, miscarriage, is less than 20 weeks. Therefore, it's considered abortion. And there's only one living baby. And therefore, we have G4, T1, P1, and A1. And one living baby. So, which one is the right answer? B. Try to pause the video, calculate it again. Be patient when you calculate it, and you figure it out. And this is the analysis of it. We have 4 pregnancies, 10 baby, miscarriage, twins, and a carrying, and then 1 term baby, and then twins, they were born, what? Preterm, right? But more than 20 weeks, and then 1 miscarriage, 18 weeks, and 1 living baby. A client presented to the OB clinic after a positive home pregnancy test. She's pregnant. Ultrasound finding confirmed ectopic pregnancy, right? Which of the following interventions should the nurse anticipate? Administer Methotrexate, schedule routine prenatal follow-up, send the client to the emergency department for immediate surgical intervention, instruct the client to increase fluid intake, and rest at home. What do you think? Analyze the keyword in the question, put it together, then figure out what you need to do. You pick your answer. This is a classic NCLEX question. When I say NCLEX is a safety question, this is it. Think about it. What intervention? The nurse you anticipate, fine. The patient is pregnant, good, but we have ectopic pregnancy. That's all. That's what the question tells you. He said, A, this patient has ectopic pregnancy, and the patient is pregnant. What would you do? Give them methotrexate, schedule them follow-up, send them to the emergency room for surgical intervention, or increase fluid intake? This is classic safety question. The right answer is 3, C. A lot of people will pick here because there's no symptoms. I don't tell you he's having pain, bleeding, nothing. I never tell you the patient is having bleeding, pain, shoulder pain, no classic symptoms of rupture. There was nothing there that tells you this patient has rupture. There's no classic symptoms. You have lower quadrant pain, left or right lower quadrant pain, shoulder pain, vaginal spotting, all of them, fever, dizziness, none of them there. But how do you know safety? Your thing is to worry about the worst thing the patient is going to go through. Ectopic pregnancy, you got to establish stability. Is this patient stable? Which is the best place? Take the patient to the emergency room, and then they can assess them. Therefore, this patient, we are not going to give them methotrexate. I think that is the safest answer. If you pick A, you can argue yourself out. But there's another question in it, and you see the way it's framed. I want you to stick around, watch that portion of it, and you can compare. And when you're taking the NCLEX and they put that question in, I intentionally put those 2 questions together. If you see the NCLEX give you the same question, they change 1 word, and that change everything. I don't know this patient is stable. Ectopic pregnancy is always emergency, no matter what. And therefore, this is my explanation. Ectopic pregnancy, think about rupture, think hemorrhage, think emergency. Even if there's no mention of there's medication is an option, we got to establish stability. We got to make sure patient's fine and everything before we can send them home. NS is assessing a client who is interested in copper intrauterine device. There's a reason why the word copper is there. When they give you a question, these are the buzzwords I call about. Underline it. There's a copper there. It's a different kind of IUD. For contraception, which of the following conditions in the client history will contraindicate the use of the device? That means if you have this problem, you cannot have copper IUD. History of Wilson disease, history of cesarean birth, nulliparity, that means never had a baby, history of dysmenorrhea, that means heavy bleeding. What do you think? Pause the video, pick your answer, let me know. The right answer is Wilson disease. Wilson disease is usually they cannot metabolize copper. They have deposition of copper in the liver, in the heart, and they have problem with in their eyes, all of them classic symptoms. And therefore, If you have worsened, you cannot take copper. Cesarean birth, no contraindication. If you never had a baby, no contraindication. If you have heavy menses, no contraindication. And this is reviewing the medication list of several clients in a neurology clinic. The nurse notes that all clients have a history of seizures and a prescription of what? Phenytoin. Which client should the nurse report to the healthcare provider? As the adapting class way of answering question, straightforward, go to the buzzword, put it together, use it to answer the question. This is the easy way to master content. The client who uses what? Copper, what? IUD for uterine device for contraception. A client who takes combined oral contraceptive pill daily. A client who uses diaphragm for with what? Spermicide. A client who uses female condom and tracks ovulation. Which one? Pause the video. Underlies the question. Once again, maternity NCLEX practice first on health promotion, reviewing things that you have to know in reproductive NCLEX questions. You pick your answer? I can tell you the right answer is staring at you, popping out like a candy, and that is what? Combine oral contraception. Why? Go back to the question, put down the buzzword, and you will see first, okay, priority report. I have a seizure. I'm taking what? Phenytoin. Boom, that should tell you. Phenytoin or anti-seizure medication. You cannot take oral contraception. You should take non-hormonal. That means you should not have hormones in it. Which of these, what? IUDs does not have hormones. Copper IUD, no, it uses copper and it kills the sperm. Oral contraception pill, you take it, it has combined spermicide and diaphragm, no what? Hormonal. Condom, no hormonal disease. Hormonal contraception associated with it. Some will say you can combine hormonal and non-hormonal, but it's still fine. This question is straightforward, no ambiguity. 3 of the answers are not hormones. Therefore, I'm picking this because phenytoin make this ineffective. And that's the right answer. Halfway, 6th question. What do you think? What is your score? Put down your comment. Let me know where you're watching from. And as usual, thank you for watching this video. Thank you for subscribing to Adapt NCLEX, and thank you for clicking on this video. You support the channel, you make the channel grow. This channel belongs to you. Let's get to it. Number 6. A client presents to the OB clinic after a positive home pregnancy test. This is the second one I was telling you about. Ultrasound confirmed ectopic pregnancy, but I give you additional information. The client is asymptomatic. There's nothing going on. His client is hemodynamically stable. Everything is perfect. Which of the following interventions should the nurse anticipate? Same answers: administer methotrexate, send the patient to the emergency room, schedule prenatal follow-up, instruct the client to increase activity to promote resolution. I've already given you the answer, and so you know. This one, we know patients in ectopic pregnancy, but I've given you everything to rule out the thinking of instability or anything. I know ectopic pregnancy is bad. I need to do something. But here, I've given you everything. Watch this kind of NCLEX question. If they give you everything, say, look, this patient is fine. The first one, I don't know, it's fine. So I have to be safe. This one is safe. Therefore, I give the methotrexate because it's not ruptured. Patient is stable. It can kill the ectopic pregnancy and prevent rupture. A client at 16-week gestation is being discharged after a cervical Cerclage placement. Which of the following instructions should the nurse include? This is a classic question. People make mistakes. In my Q bank, when I answer the question, I know specific answers they will pick. I will tell you, check the device strength weekly and report to the ACP if not visible. Report uterine contraction or lower back pain. Expect heavy vaginal bleeding for 2 to 3 days. Increase physical activity to promote circulation. Which of these should the nurse include? Pause the video, answer the question, let me know. Put your answer in the comment where you're watching from. What is your answer? The right answer, I can tell you, is contraction. Cerclage. What is cerclage? If this is the cervix, and the cervix is here like that, and this is the vagina, like this is the uterus and the ovary, the cervix, it will become incompetent during the second trimester, and that lead to miscarriage. In order to prevent miscarriage, women who've had multiple miscarriage at least 3-4 times, we're going to suture the cervix during the second trimester, early second trimester, because that's where it occurs, most miscarriage. And so we suture it in place. You don't see any string hanging like that. This is not IUD. That's the difference. IUD, you see the string hanging because you go into the hole of the cervix, into the uterus. You go through the cervix into the uterus. This one, we suture the hole so that the cervix doesn't become incompetent, and then efface and dilate, and baby comes out. Therefore, we don't see the sutures. So one is a trap. If you say looking for the string, you're not going to see it. What is the problem? This is usually kept in place to 37 weeks until patient is about to go to labor. And when we remove the sutures, because you can't have the sutures in place while you're in labor. Because of that, we got to schedule you to come in, and then we'll remove it. Therefore, if the patient start having signs and symptoms of labor, that's a problem. And therefore, that's why they got to report uterine contraction, lower back pain. That means signs of labor. Heavy vaginal bleeding, we don't want you to expect it. Physical activity to promote circulation, you should not do that. That's bad problem. You go into labor. Therefore, 2 is the right answer. And next is the OB clinic is returning phone call, prioritization. OB, which client should the nurse call first? Who problem is a problem. 35 years old, when they come to reproductive, always when you're looking at, they give you OB question about reproductive, think about things that you should expect or not. And therefore, don't worry too much. They were going to give you a bunch of symptoms. Then you ask yourself, is this consistent? 5-year-old client. Patient has endometriosis. What do you expect? Well, pelvic pain when you have intercourse. 29-year-old client. Report mood swing, bloating, breast tenderness prior to menses. Is that what you expect? 65-year-old reporting abdominal bloating, early satiety, and pelvic discomfort. Is that what you expect in a 65-year-old? And a 30-year-old, he said, report what? Thick white cottage cheese vaginal discharge with itching. Who are you going to return the call? The first one, second, third, or fourth? What do you think? Expected finding. You got to be sharp. You pick your answer? This lady, 65-year-old, worry about ovarian cancer, bloating, early satiety. Well, early satiety is a sign of cancer or cathetic living, and a pelvic what? Discomfort. That means they have pelvic mass, ovarian problem. Endometriosis. Well, if you have intercourse, it's going to hurt. What is the problem? If you're going to have your menses, you have bloating, breast tenderness, mood swing, that is premenstrual syndrome. Don't worry about it. And this is a yeast infection, cottage cheese, vaginal discharge. It's not a problem. And this is providing discharge teaching to a client after insertion of progesterone releasing what? IUD, basically an IUD. Which statement by the client indicate correct understanding of teaching? I expect every menstrual bleeding each cycle. I will use a heating pad for severe abdominal pain. I will call my air care provider if I cannot see the string of the device. The IUD will protect against sexually transmitted infection. What do you think? Which one is a priority? What do you think? Which one? You pick your answer? Yeah, you should pick it. Let me know. Now I told you about IUD. If you can seal the string, it may be displaced in or out. Therefore, that's a priority. Every menstrual bleeding, you should not expect that. It can control your bleeding. Heating pad to the abdominal pain, severe abdominal pain, it may be perforation. It can perforate your uterus. You should call the doctor. It does not protect against sexually transmitted disease. Therefore, C is the right answer. Number 10, a client at 18 weeks gestation returned to the clinic after amniocentesis confirmed the fetus has Down syndrome. Amniocentesis, I have Down syndrome. The client is quiet, avoid eye contact. This is therapeutic. Which action should the nurse take first? Patient just found out carrying a baby, it's a Down syndrome. Do you provide information about pregnancy termination option? Do you refer the client to genetic counseling immediately? Do you provide information about Down syndrome? Do you evaluate the client understanding about the diagnosis? This is therapeutic and what nurses do. You know how to do it. You do it all the time when you're working. Why don't you bring that knowledge here in that situation? This specific. When it comes to therapeutic, you know what to do. This is not specific to specific content. This is therapeutic, and you know what to do. As usual, you assess before you give what? More information. Evaluate the understanding, then provide what? Information about the pregnancy termination option or information about Down syndrome. Who cares? She doesn't want to terminate pregnancy. How do you know she want to do that? Does he want to see genetic test counselor? Does not matter. You got to let them know what they think about Down syndrome, how they feel about it, what do they know. Then you provide information. You have knowledge to do that. Then you can give them anything you want. Assess first before education. And then it's providing digital teaching to a client following vasectomy. Don't worry, don't forget about men. Men is part of reproductive, right? Vasectomy. And therefore, which of the following instructions should the nurse include after vasectomy? Use alternative form of contraception until sperm count is 0. Apply warm compression to the scrotum immediately, intermittently for 24 to 48 hours. Expect immediate sterility after the procedure. Resume normal activity immediately. Submit semen sample for analysis every 2 months until sperm count is 0. You heard about vasectomy. It's a main sterilization technique. What do you think? Which is the best way? We cut. This is the way vasectomy works. If this is the penis and this is the scrotum here, the vas deferens come from here like that. And this is where we have the sperm come, the production of this sperm here, and then go through the vas deferens, go through the urethra, and it comes out. So when we do vasectomy, we divide this. So you can still make some sperm, but it doesn't go across it if we divide this. Therefore, how would you do? What kind of teaching do you provide them? This is what vasectomy means. That means we're disconnecting the tube that takes sperm into the urethra, and then it comes out. So we're cutting this off. What do you think? You pick your answer? I know you pick it. Yes, you need alternative form of contraception. If you have to wear condom, your wife have to wear a condom, anything that will help with that. After the procedure, cold compression, warm compression, open. I have a video on cold and warm therapy. It's easy to miss this kind of question. If you mix it, it's okay. Now you know. Warm compression, open things up, allow more blood flow. Cold compression, decrease blood flow, and it prevents edema. Same thing. When a woman wants to like breastfeed, they want flow, therefore warm. If they don't want to breastfeed, then you give them cold compression to prevent blood from going there. This is it. No warm compression. Otherwise, you get scrotal edema. Sterility takes time, right? That test-taking strategy. If A is right, C cannot be right. You cannot resume activity immediately. You just had surgery. You have edema, hematoma, sperm count. Do you think we did surgery today? We have to wait 2 months to get your first semen specimen? No, it's every 2 weeks, every two to 4 weeks, they have to do that. So this is the wrong answer. Only one answer here, just to let you know, is easy way to trap you and easy ways to lose point. And that's why these answers look like that. And the last question, prioritization. As usual, you should expect a bunch of symptoms, but don't get distracted with one symptoms. Put them together, totality. A nurse in a healthcare clinic is assessing several what? Client, woman health. Which of the following clients should the nurse see first? Client is reporting what? Severe lower abdominal pain. He had a fever. He has a foul smelling vaginal discharge. Client reporting what? Wide vaginal thick discharge coming out. 20 weeks gestation, reporting urine frequency and burning. And then the client client want to know information about contraception. Who do you think we should see first? Who? Of course, this guy had infection, PID. This lady probably, most likely, used infection. This is classic 20 weeks pregnancy, pushing on the bladder. You're having excessive urination. And if you want to know about contraception, I have time for you. 12th question. What is your score? If you get less than 65, it's okay. You know the content in a very short time. The next video that will show up is the previous reproductive NCLEX practice question, NCLEX practice test to help you consolidate and haze your head promotion questions. Thank you. Subscribe to Adante Class and enjoy. Take care of yourself. Happy Sunday.